The most common mental illness in the world, anxiety disorder. Anxiety disorder is the most common mental illness in the world, according to a World Health Organization survey. 20% of adolescents experience a mental health problem, most commonly depression or anxiety. 70% who attempt suicide have an anxiety disorder. Mental disorders like anxiety with behavioral disorders are the primary reason 20 to 29-year-olds are disabled and cause 40 million years of disability. Anxiety is not a first world problem. Anxiety disorders are in the top 10 reasons for disability in all regions across the world except East Asia and Eastern Europe. Anxiety disorders hit tropical Latin America hardest as a reason for disability behind low back pain and major depressive disorder. There are 6 main types of anxiety disorders. Generalized anxiety disorder, long-lasting anxiety not specific to its situation or object. A panic disorder, a quick hit of terror often followed by trembling and difficulty breathing. Obsessive-compulsive disorder, repetitious obsessions and compulsions. Social anxiety disorder, an intense fear in and of social interactions managed with avoidance. Specific phobias, fear of a specific situation or object. Post-traumatic stress disorder, and anxiety from a traumatic experience. What are the symptoms of an anxiety disorder? 36% of people with social anxiety disorder experience symptoms for 10 years before seeking help. Respondents in interviews with the US Census Bureau regard symptoms of an anxiety disorder as normal, while mental health professionals treat such symptoms as abnormal. So here's how to spot an anxiety disorder. You may feel constantly on edge. You experience a shortness of breath. You get a pounding heart. You sweat. You have insomnia. Often in your head, fears remain even though you know the outcome is impossible. You avoid everyday activities because of the anxiety. Think you have an anxiety disorder? Relax. There's nothing broken with you. Anxiety doesn't limit you, only your choice can. You can live a great life. Well-known people with an anxiety disorder include Susie O'Neill, Sigmund Freud, Adele, Johnny Depp, Whoopi Goldberg, Barbara Streisand. So will you seek help? Every famous athlete admits to feeling anxiety. You can feel anxious because you care. Anxiety is normal, so be with it. An anxiety disorder differs from anxiety in intensity and duration. It's normal to be self-conscious and embarrassed at an event and enters towards a disorder when you avoid the event because of such fears. So what to do about it? Build relationships with people important to you for social, physical, and emotional support. This promotes comfort, safety, and recovery from long-term mental health effects. Most people recover from anxiety disorders over time if they are able to restore their basic human needs and get support when needed. Develop skills to perform well in situations you're anxious over. Competence leads to confidence. Unfamiliar territory produces fear and anxiety. Your support network and skill development makes the unknown known. Minimize caffeine intake, quit smoking, and drink in moderation to reduce a pounding heart and body jitteriness. Seek professional help from a psychologist. Feeling good is not a condition of living good. Instead of wanting a feeling to disappear, then behaving a particular way, be compassionate with yourself and directly go to the end result of living a meaningful life. Avoidance can manage anxiety, but rarely helps over time. Learn how a world-leading anxiety expert dealt with his social anxiety at towerofpower.com.au/anxiety.